Hi, my name is Adam Crowl. I'm an orthopedic spine surgeon at OrthoVirginia. I practice at the St. Francis location. The first thing I'd like to cover is how to maximize your appointments when you come in to see a spine provider or a medical professional with your spinal problem. I think to maximize one's ability to get the most out of that appointment, both from the patient side as well as confidence from the provider that they know what your problem is, I think there's a few strategies that you can utilize to maximize and make your time as efficient as possible. Many patients, I've been one before, where we've ended up spending the morning at the doctor instead of the 15-minute appointment. Oftentimes, a lot of our appointment is information gathering. And I think a lot of that information gathering we can do ahead of time, both through more targeted questions, as well as more targeted responses from the patient that helps us maximize the time that we're in face-to-face discussing your particular problem and answering your particular questions and developing a reasonable plan that both of us can agree on. So I'd like to discuss some opportunities or tips to try to maximize your appointment here at either OrthoVirginia, another spine colleague of mine, or a medical professional in general. The most important thing is that our time is generally limited. So as much information as you can bring with you to the appointment is essential. Some very important things are bringing a current list of medications. Why is that important? That is important as many patients may be on certain medications that may interact with something that we would like to treat you with, and we need to know that. We also need to know your allergies. We also need to know that if you're on blood thinner, which is a very common thing these days, because that may change our approach as what we can offer to you as a patient. Additionally, we would like people to bring as much of their imaging data as possible. There's a general misconception that doctors have access to all the patient's medical history, and that just generally practically doesn't occur. So as much as we can have patients bring previous imaging, or at least know where the imaging was, to the appointment, that can be reviewed even before your appointment. That way the provider understands what you have already had done. Additionally, oftentimes particular studies have been done elsewhere that maybe we're asking to repeat. A very common issue in spine is that as patients have gone either on orders from their primary care physician or in an emergency room, they come in to get x-rays of their spine, but they're done laying down. However, patient oftentimes has symptoms, mostly when they're standing up or with weight bearing. So we may want to repeat those kind of x-rays and see if the spine changes when you add gravity to the situation. I think additional opportunities for us are about what is your particular problem. Many patients have had problems for several years, even going back to childhood with their spine. There's other patients who had only had symptoms for a few days or a few months or a few weeks. Our ability to maximize the time answering your questions is trying to be as specific as possible with your complaint. What is it that's actually bringing you in for a particular visit? Is it pain in the center of your back? Is it pain in the center or the upper part of your neck? Is it pain going down your arm? Those specific complaints help us to be able to hone our diagnostic skills, particularly to your problem.